welcome to Guest Room. This is me, Anjali Menon, here with you. Today we are going to introduce you to three doctors from the Department of Speech and Hearing. Dr. Kerstin Moller from the Health and Medical Department, Dr. Germundsson from the Milano University, Sweden, and Professor Berth Danermark from the Swedish Institute for Disability Research. Let's welcome them to the show. Hello ma'am, welcome to the show.
Thank you.
So, first of all, we would like to know more about you and what are you into?
My name is Kerstin Moller and I come from Sweden, from the Swedish Institute of Disability Research. I'm a researcher, I'm a doctor at Disability Studies and especially in the international classification of health, disability and...
Can you explain what ICF means?
When we think about a disease, we think about the injured part of the body, a hand is broken for instance. But when we think about health, we think more about what are the consequences of a broken hand, and that different in different situations. So, for instance, when we sit here and talk, a broken hand doesn't matter so much. But if I'm going to cook something, a broken hand will affect a lot, or do some typewriting or something like that. So it differs from situation to situation and from person to person. So in order to capture consequences, this is created. Actually, it is not improving the quality of life for the person. It is improving collecting data directly, but indirectly, how we ask the person and how we approach the hearing impairment, we as professionals, yes, we can improve quality of life. I have seen that when I worked with professionals that when we have implemented the ICF.
Mm-hmm. In your point of view, what do you think, like what does media, how does the media play, does it play an important role in bringing awareness to the people about ICF?
Yes, I think media is important because ICF is not so well known. Mm-hmm. And I think it is an important, a great new tool to approach documentation about health and think about health, really. That is not only the broken hand, like I said, or the hearing impairment, but also what people are doing in their daily life, about the impact of, for instance, a hearing aid and the support from other persons, the attitudes, the services from the state or something.
Society.
Yeah. So all this could be captured in a statistically way, and it could be systematic but also flexible. So I think it's an important tool, and the more it could be spread that this is now and could be launched and could be used by all kind of people actually. Audiologists like here in the conference, physicians, but also teachers and other professionals.
Okay, ma'am. Okay. Thank you, ma'am. Thank you for spending your valuable time with us. Thank you very much. Hello, sir.
Hello.
So, as you know, we would definitely like to know more about yourself. So, can you just tell me what are you into, and which is your field?
My name is Germundsson, and I come from Sweden. And I currently work at a university in the south of Sweden called Malmö University. But I'm also affiliated to the Swedish Institute for Disability Research. And I am a senior lecturer in social work with a special interest in rehabilitation and disability. And this is also the area for my research.
What area are you totally into in your research?
It's many of the questions that I address are connected to collaboration between different professions within the welfare state, if you will. So it could be professionals in audiology, it could be doctors, it could be social workers, and so on. So in collaborating around persons with complex problems.
And also, sir, we would like to know, could you please share one of your most important results in your research?
I'm interested in the relations between the persons and the surrounding society, and we are talking a lot within research about a holistic perspective and a biopsychosocial approach and so on. What I've seen, however, when I spoke to professionals, we often tend to, and I say we because I have also been working in this field earlier before I started in my academic career, that we stay mainly interested in the person and the personal factors, but that we often tend to forget that there is a structure, there is a big society behind with laws and with a lot of restrictions that is not only on the personal level but on a structural level, and that we tend to forget this as professionals. So I try to give this perspective to our work.
Okay, so how important or what's the role of a society and how do they react?
I think it's a question of very much a question of interaction. So even the society, of course, consists of persons, but we as societies we have cultural ideas and we also have laws in society, but they are of course written by persons, by individuals. I think about the ideas and the attitudes and the representations that individuals have, and they affect both on the individual level and on the society level. So in that case, the society, of course, is an interesting player here.
Okay. As a senior lecturer in social works, how and why did you find interest in health and medical issues?
I mentioned earlier that I've worked not inside the university for all my life. I've had a previous work life, and I worked for many years with providing education in the field of vocational rehabilitation. So in that job, working with this, I started to develop this interest and try to look more into it, and also was looking for a way of explaining things that I saw. So that's why I, so to say, turned to science to try to explain a lot of things.
Do you find any relationship between the rehabilitation process and the surrounding society?
Yes, most definitely I do. That is one of my interests. Right now I have a research project where I look at the collaboration between different professions in providing rehabilitation to persons with intellectual disabilities. And I see that a lot of this rehabilitation relies on how the society reacts, and the possibilities for these persons is very much in the hands of the society. So I think they are absolutely correlated, yes.
Thank you very much, sir. Thank you for spending your valuable time with us, and hope we meet soon.
Yes, thank you for having me.
Thank you. Hello, sir. Welcome to the show.
Thank you.
So, first of all, we would like to know more about you and your research and everything.
Yes, my name is Berth Danermark. I come from Sweden. I'm a professor in sociology, and I'm one of the leaders of the Swedish Institute for Disability Research. And I'm also affiliated to the Audiological Research Center at the University Hospital in Örebro, which is a middle-sized town in the middle of Sweden, where we conduct research on different aspects of many forms of disabilities, but our main focus is on communication disorders and problems related to communication, such as hearing loss.
What is your main research interest?
The main interest is related to communication. For 40 years ago, when I graduated as a sociologist, I was very interested in communication, conversation analysis, and issues related to that. But after a couple of years, I come across research related to hearing loss and communication, and I discovered that by doing research in the field of hearing loss would amplify all the issues that are raised in communication in between human beings. So I became very interested to do research and focusing on persons with hearing loss, and it was quite natural for me to slightly orient my research in that direction, because I come from a city which is the center for deafness and hearing impairment in Sweden. It has the national schools for hard of hearing and for deaf students, and it has a number of institutions related to deafness and hard of hearing. So it was very easy to get involved in that kind of research. So the main takeoff for doing research in the field of audiology was for about 18, 19 years ago, when I set up with a colleague the first research institute in Sweden about hearing loss from a broader psychosocial perspective. The city where I'm working is a center, so we, just to give you a figure, about 80-90% of all deaf teenagers, they live in my hometown. So that means that we are used to deaf culture, we are used to sign language and so forth. So that's one reason it became natural and interesting to focus on this aspect of communication.
Okay.
So that does not mean that we have a huge number of persons with hearing loss in Sweden. The general figures indicate that there are about 10 to 11% of Swedes that have hearing loss, but it is the figure differs between countries because it's quite difficult to measure exactly in the same way between countries. But I think that the figures that 1 of 10 have a communication-related problem due to hearing loss is quite normal in Western countries.
Which is the area that you are currently focusing on in your research?
For the time being, I am involved in 3 larger research projects. One is related to what is called International Classification of Functioning Disability and Health, and it's a collaboration between my research group at the University Hospital and WHO and the ICF research branch in Munich in Germany. We are trying to create what is called a core set. That means that the generic classification, which the international classification consists of, it consists of more than 1,400 categories, but what we are aiming at is to find out which are the core, which are the most important categories for doing holistic assessment of the patient with hearing loss. So that's one of my research project I'm running for the moment. Another is, and I have to give you a short background, that WHO, that means the World Health Organization, they have constantly recognized a problem of non-adherence and non-compliance when it comes to long-term healthcare therapies and so forth. And one of the problem is that, or I could say one of the solutions is that the medical rehabilitation, especially when it comes to long-term therapies, has to be more patient-focused, taking the whole patient into account, all the needs, all the wishes, and also to extend the interaction between the caregivers and the patient. So we have recently done a global study of what are the hindering and facilitating mechanisms for further implement a more patient-oriented rehabilitation. And in this case, it is about audiological rehabilitation. And we have found that there are a number of important hindering mechanisms and important facilitating mechanisms. One of the facilitating mechanisms is the professionals. They have to be devoted, they have to be self-secure, they must be in a position so they can leave their comfort zone and try new ways of working. And in that way, they need scaffolding, they need tools to improve and support their work. And one of these tools is what we are developing in the first project I mentioned, the core set for audiological rehabilitation. The hindering mechanisms are related to lack of resources, non-flexible system when providing hearing aids and things like that. That means that law and regulations are not flexible enough. So there are a number of hindering and facilitating mechanisms. And then there is a third project, or I could say a number of projects related to persons with dual sensory loss, with hearing impairment and vision impairment, and especially when it comes to the elderly. We do not know much about acquired dual sensory loss among the elderly. This might not be a problem in India, but in many Western European countries and also other countries, we are facing a huge increase of elderly, and we have not so far developed validated and reliable rehabilitation methods to cope with the issue that many elderly people are losing their vision and their hearing simultaneously. Because if you just lose one of the senses, the function of one of the senses, it can be compensated with the other senses. But when both of the senses are deteriorating, you quite fast run into severe problem to cope with the everyday life situation.
Okay. Could you share with us one of the most important results in your research?
The most important outcome or take-home message of all the projects I mentioned is that we need to broaden our understanding of the patient's situation. We need to take into account psychosocial aspect, environmental aspect, attitudes in the society, relation in the extended family and the close family, and all. There are so many aspects that has to be taken into account beside the purely bodily medical issues that had to be dealt with. You could put it in that way if we talk about hearing related issues. Amplification is a necessary condition for good rehabilitation, but it's not a sufficient condition. We also had to address a number of other issues. That is the overall outcome of my research.
As a sociologist, what promoted you to make an interest in medical and health issues?
As I said in the beginning, as a sociologist, you are dealing with interaction with the environmental issues, and you could say that you are not only focusing on individual, you are also putting an individual in a much larger context. When I come across for the first time the medical sector, and I start to work with people involved in more focused medical issues, I quite soon discovered both the need of enlarging the approach, but also that social scientists could really contribute to this process.
Thank you. Thank you for spending your valuable time with us, and I hope we meet again.
Thank you.